Now we are going to look at the common musculoskeletal injuries, but I'm not really discussing the various injuries because that has been done in detail in the class. We are only going to look at what do we do if there is an injury. So any injury out there is basically a tear of some tissue, and we grade them like this: grade 1, grade 2, grade 3. In a grade 1 injury, the person will have only the pain, but they will not have weakness or loss of function. In a grade 2 injury, they have pain and weakness, but they don't have loss of function. Whereas in a grade 3 injury, they have pain, weakness, and loss of function. What that means is, in a grade 1 injury, there is microscopic tears as seen here. In a grade 2 injury, there are some fibers which are disrupted, but minimal number of fibers disrupted like this. And in a grade 3 injury, there's almost a complete tear of the structure. So it is far more serious there. So we as trainers only come into the picture with the grade 1 injury, and we can work with clients with grade 2 injury for rehab in conjunction with a doctor, medical professional, orthopedic, or physiotherapist under their guidelines. But we don't really touch grade 3 injuries. If somebody has a grade 3 injury, clearly they should be working very closely with doctors or medical professionals. And only when it is sorted, they come back to us for, training. So this is the gradation of it. Now, whenever there's an injury, it always results in something called as inflammation. And the characteristics of inflammation are: first, swelling, pain, redness, it becomes red in color. Then you have temperature increase, and finally you have loss of function. These are the 5 characteristics of inflammation. So any injury will lead to an inflammation, and these are the characteristics of it. If it is a very mild inflammation, generally you don't get to see redness, or you can't perceive the increase of temperature so clearly. But more the swelling is, and more the inflammation is, and more you start seeing all of these characteristics. And whenever you have an inflammation, we indicate that with a suffix called as itis. Like, for example, if it is a tendon inflammation, we say it's tendonitis. If there is an inflammation of ligament, we say it is ligamentitis. If it is a muscle inflammation, we say it is myoitis, like that. So, whenever there is an injury, and of course, which is leading to an inflammation, what we do as trainers is a protocol called PRICE. PRICE. This is what we follow. P stands for protect, R stands for rest, I stands for ice, C stands for compress, and E stands for elevate. And we as trainers only follow this, irrespective of what is the injury. We only do these particular protocol. This is what we follow. So the first one is protect. So when a person is injured, we as trainers first will want to protect it. Protection means we don't want any further injury or damage to that particular site. So you will not do anything to make it worse. Okay, so that is the first one. Second one is rest. Rest does not mean complete rest from all exercises. Of course, let us suppose the right shoulder is injured. You will still work your left shoulder, your left arm, legs, and core, all that you will do. And even with the right shoulder that is injured, you will not do those activities which are causing pain, but you can still do other things. For example, let us suppose the right shoulder is injured and you're not able to do the pronated grip press, but Let us suppose if I were to keep it in a neutral grip, I'm still able to do the presses. Go ahead and do it. There's no problem. Similarly, maybe this presses are a problem, but I can still do the side lateral raise and rear delt extension. We'll still do those. We'll just try to avoid those movements which are causing the problem. So that is the meaning of rest. So in this case, the rest is active rest. It is not a complete cessation of the exercise. Next is ice. And this icing only works in the very initial stages. Okay. If the inflammation is severe, what we do is we go for icing. And the way to ice is you will use the ice bag. You'll never keep ice directly on the skin. You'll use an ice bag, and you will apply the ice on the injured portion. You'll compress it a little bit, and you'll keep rubbing till the part becomes numb. Then you're going to remove it once the injured area is numb. Let the blood flow resume in 1 or 2 minutes, and again put it back. You'll do it like this for about 10 minutes, and you will do it like this for say 2 or 3 times in a day for the first couple of days. After that, it really doesn't matter so much whether you ice it or not. So that is the icing part. Next one is compression. We do this only if the inflammation is very severe. If the inflammation is too much, we'll use a crepe bandage, or maybe we'll use a elastic band. So something like that to arrest the inflammation. Otherwise, we don't bother doing this. The last one is elevate. So we want to bring down the inflammation. That's why we are elevating that region which is injured. Like for example, if a person has a lower limb injury, like a leg injury, if we keep the pillow below the legs and let the blood flow resume, go back to the heart. So we make them lie down, we keep the pillow below the legs and let the blood flow back to the heart. Similarly, if their arm is injured, we make them lie down, keep the arm on a pillow so that the blood can flow back to the heart so that the inflammation can come down. So any injury out there, this is the protocol that we are going to follow. PRIC. We don't do anything beyond this. But what else can be done? A lot of things, like they could be prescribed non-steroidal anti-inflammatory drugs. This is something which can be done. Or they could be prescribed physical therapy. So in physical therapy, probably they could be advised ultrasound treatment, they could be advised infrared treatment, something like that. Let us say this is also not working, then if the pain is too severe, they can be given corticosteroid injections, like cortisone injections, or in very severe cases, maybe a surgery could be recommended. Now, we as trainers very clearly have this limitation. So for anything out there, this is what we are going to follow: PRIC protocol, irrespective of whatever is the injury out there. So what we are going to do is, if let us say your client comes and tells you they are injured and they have a sharp shooting pain at a particular place, you're going to use this PRIC protocol. You'll wait for a couple of days, see if the pain is coming down, and if it is coming down, then you will continue doing the active rest and recovery part, and slowly start increasing the resistance and the volume over a period of time, and make sure that they come back to whatever they were doing. But if that is not the scenario, if even with the rest and recovery protocol, PRIC protocol, it's not helping, in the next 2-3 days it's become worse, or the pain is not reducing, then they have to go see a medical professional. So this is what we do when it comes to the injury.